Hello there. I wanted to take a minute today to answer some questions on a recent Q&A I did on my Facebook group. If you're not a part of the Facebook group yet, it is the Window Pane on Facebook. Go ahead and request to join if you'd like to be a part of these weekly Q&As to get more information on CRPS, bust common myths about CRPS, and help yourself move forward and gain hope and have some of those questions answered that maybe your providers couldn't answer or wouldn't answer or just didn't take the time to listen to. Um, Honestly, that's one of the biggest things I think with the condition is a lot of us aren't listened to and or believed. And I think that's where a lot of chances for remission or recovery get missed because we aren't heard, our fears aren't calmed down, and then we just perpetuate in this pain cycle that seems never ending. So yeah, I wanted to take some time each week. I think I'm going to do this weekly in my group to answer any questions that you guys might have related to pain, CRPS, etc. So the first question I'm going to share here. This is going to be from Cassia in my group. She asked, "Is swelling a normal part of CRPS? I have it constantly, and I think it's putting pressure on my nerves in my leg that I had operated on, and it's irritating me even more." So, swelling is something that can happen with CRPS. It's not necessarily a normal part because some people have CRPS and have no swelling. This is the same thing is true with heat changes as well as color changes. Some people have CRPS and don't have color change. Um, but it is something that can happen, and swelling can be uncomfortable. It can make your limb feel full. It can make it feel like there's pressure on our nerves. The best thing we can do for swelling is movement. The reason for that is because the veins in our legs have valves that sit like this, and those valves open with movement or muscular contraction. So if we are not moving and just keeping our limb in the same place or just propped up on something, we will probably get swelling. And this is true for someone without CRPS. Okay, so if we don't move our limb at all, we will probably start to have swollen legs. And that's the reason why, like when you go into surgery, they put those compression stockings on your feet because it's pumping the leg, which is what the muscle should do. And that pumping takes the valve in the veins and it opens it like this. And you can see this motion. What is this doing? This is taking the blood and the fluid in the leg. Every time the muscle contracts, the valve is going down, up, and it's scooping the fluid and pushing it upwards. Okay? So just imagine that. So when we get the swelling, even though it hurts, one of the best things we can do is try to walk, or we can do an ankle pump where we take our ankle and just go like this. That's going to contract the muscles in the leg, the calf muscle, and it's going to take those valves and push them up. Okay, another question here from Cassia. She said, I'm so sorry if I'm saying your name wrong, by the way. It looks like Cassia. So correct me if I'm wrong in the Zoom tomorrow. Um, it says, does aquatic PT ever help? I was recommended to try instead of regular PT to help with pain and swelling. Aquatic PT can actually be really helpful, and the reason for that is because it's low impact. Okay, so when you are in regular PT or walking normally, you will be feeling the full force of your weight on the limb. Okay, with aquatic PT, it's low gravity. You weigh less in the water. So that's one reason. Another reason is because of the pressure of the water around your legs or around your arms, depending on the affected limb. That's going to push on the limb in the same way like a compression stocking would. And again, that valve change. Okay, that's going to happen as well in the water. Another thing the water can do, if water is soothing to you at the right temperature, for some people it's not, is it can act as like a noise cancellation. So your body has its alarm system, which is hyperactive with CRPS, as we've talked about before. And what is happening is when you get in the water, is sometimes it can act as noise canceling headphones. If you've never experienced what noise canceling headphones are like, go ahead and go like this with your hands over your ears and just cup it and notice how the sound sounds around you. It sounds muffled. Okay. The nerves in our ears are taking in information and sending it to the brain, and then the brain decides what to do with it. It's the same thing with every nerve in our body. We take in information in our feet or our hands, It sends information to the brain, and the brain decides what to do with it. If we are muffling that information, it doesn't feel as intense, and so we might not feel as much pain while doing aquatic therapy. So for some people, aquatic therapy is really helpful to get started and move towards doing regular PT or walking on regular land. This is the same for athletes like with ACL tears. Sometimes they're not ready to put all their weight on that torn ACL in their knee, and so they'll be on like an anti-gravity treadmill or they'll be in the water. Okay. All right, let's see, going down the list. So Lauren, what was it like being pain-free? Um, Also thankful for opioids, but one day I want to be able to divorce them. Did you have a problem with feeling bad about taking medication to help you get through tough times? Um, I want to walk without them one day and be positive. Okay, so and she also says, how did you know your CRPS was in remission? So it says, what was it like being pain free? I think you mean, what is it like being pain free? Because I currently do not have any pain, and I have not for 7 years. Um, it feels great. If you don't remember, hopefully we can get you back to a point that you are or starting to not have pain. I want to make it clear that this process that I take my patients through and that I went through myself, it is not a easy process. It is not like you're going to wake up one morning and it's just going to be gone. I think that's the hard thing about a lot of treatments for CRPS. A lot of people, and I wish this was possible, but a lot of people are hoping that it'll just be gone like that. This is a step-by-step, pun intended, process to slowly get out of pain. When it comes to opioids, I don't know if I'm the best person to ask for what I did personally because I was so fed up with the medical system and being disappointed by my doctors that I flat out stopped them cold turkey, which I do not recommend at all. I recommend working with your doctor, having a slow weaning off process, and if sometimes you have to take medicine to help you use as a bridge to be more active, that's okay. You don't have to shame yourself for needing to have some assistance with getting out of pain. With a lot of my patients, they will use, gabapentin or the occasional opioid or sometimes THC or different products to help them reduce the pain and the activity of the nervous system, the alarm system, to give them opportunities to start moving again. Then, as they start moving again and it gets more tolerable, then they start to taper off their medication. So consult with your doctor, let them know, hey, I'd really like to be able to get off these pain meds. Can you help me with a tapering process to reduce that? Okay. All right. Tammy, uh, she asked, hey Chase, CRPS in my right foot, 7 years. It hot flares daily. I purchased a thermometer and I measured the temperature. The redder it gets, the more painful to stand on, and other symptoms worsen. Cooling it down is the only thing that lowers the temp and relieves pain. Question: can your desensitization treatment methods help in actually lowering the temperature of an affected limb or area? Of course, I cannot wear socks or shoes. Thank you. So Tammy, yeah, when we're desensitizing, maybe something we need to do is cool it down first. So if you feel like cooling it down is helpful, you can use cold rag, cold ice, a fan to blow air on it, anything that you think is helpful in cooling it down. But then you're going to start to do the desensitization treatments, which would be, touching it with something very gently, moving it very lightly. If your goal is to start wearing shoes or socks again, then maybe you start touching the foot with textures that feel like socks. So that could be like a bath towel, a blanket at your house, actually a sock. But I encourage my patients to use things that bring them comfort. So if you have like a childhood stuffed animal or something that feels safe to you, start barely touching the limb with that object. It can be as little as 5 times a day you touch it for the smallest amount of time. So it could be like just like that. That's one. Okay. It depends on wherever you're starting. Everybody starts in a different place. You don't have to go wild to get benefit. Anything is better than nothing. So Yeah, if you want to start to get there, start to desensitize and calm the alarm system, I would start there. As far as the temperature goes, I would encourage you to focus not too much on taking the temperature of the limb. The reason I say that is because the more that we focus on the symptoms and the more that we hyperfixate on them, the more fearful we might become. So we take the temperature and we see that it's a little different than our other limb. We might that might make us think that, oh my gosh, things are super bad, and that amps up our nervous system, amps up our alarm system, and makes us kind of scared to move forward. So it actually ask you to not use the thermometer so much and instead just focus on cooling down the limb and then doing the desensitization. And then what you might find later on is when the pain starts to come down and that intensity starts to come down, you might find that that temperature discrepancy starts to reduce or disappear because the alarm system isn't so hyperactive anymore. Temperature changes, swelling, redness, color changes, that's all the alarm going haywire. A good analogy I use for this is like imagine a normal car alarm going off, it's just the horn beeping. Now imagine a malfunctioning car alarm, which is kind of what's happening with CRPS. Not only is the horn beeping, but the windshield wiper fluid is shooting out, the windshield wipers are going everywhere, the lights are turning on and off, all kinds of things. Okay, so that's two different types of alarm systems: a normal one in a normal body or a normal car, and the malfunctioning one, which is in a malfunctioning car or unfortunately the CRPS nervous system, which is right now, but it's not forever. Okay, we can reprogram it to heal. Okay. Lindsay Hamilton said the statement of no pain, no gain is made a lot in PT. At what point would you draw the line between break or making myself fight through? I remember times crying in PT to push through, and it felt like too much. Lindsay, I'm very sorry that you had that experience in PT previously. I do think that there's some things to the statement no pain, no gain, but I changed that statement to no KNOW pain, no KNOW gain. Okay. We need to understand what's happening with our pain, and that's how we make progress. So I would not be pushing someone so hard that they're crying. That's a little too much. What I would be doing is I would be helping you feel comfortable and safe in pushing into some discomfort and then taking breaks and pacing yourself as needed. That's why I preach, we'll move our toes, wiggle our feet 10 times in one day and that's it. That type of intervention is more helpful than like forcing someone into something that's really painful and just elevates their fear and elevates their alarm system activity. So PT is very, very slow to start, and then it ramps up as our pain starts to come down and things start to calm down. So what I like to say is calm things down, build things up. That's the process with PT. So yeah, we can talk about that some more in the Zoom as well if you have more questions about it. Let's see. Next one. Kimberly, is SVT, supraventricular tachycardia, or other heart issues caused by RSD or CRPS? Or is it due to the effects from pain from RSD or CRPS? I was recently diagnosed with SVT. I know a lot of other health issues can arise with RSD and CRPS. So with this one, this is a broad thing I just want to get out there. Correlation does not equal causation. Okay, so just because there are people with other health issues and also have CRPS does not mean that CRPS itself was the cause of these other health issues. There are too many variables to attribute to CRPS all these other health issues. So SVT is a separate thing. It's not caused directly by CRPS slash RSD. Um, it could be something that's a side effect of medication. It could be a genetic thing. It could be something else. I'd need to know your medical history to like properly answer that question. And that's something you can discuss with your doctor. But I would say no, it's not caused by CRPS. Along with a lot of other things that get brought up, people will bring up gastroparesis. They'll bring up what else? Episodes of syncope. They'll bring up a lot of other things that are correlated with CRPS, but that's not a causative thing. It's the same thing as saying like a swimming pool causes drowning. just because people drown in swimming pools doesn't mean that a swimming pool is the cause. That's a hyper simplification, but that's what I need to do to make sure that we know that CRPS is it's a malfunction of the nervous system, the way that signals are being sent to the brain and the body that is causing pain. The signals are being misinterpreted, but it's not a disease that is creating all of these other things within the body. The body might develop these other things because of all the medications we might be taking, all the treatments we might be trying, all the stress of just being in pain all the time for so long. But it's not a direct cause of these things. Okay. October. Let's see. So October is asking a question about weaning off opioids as well. The same thing that I said to Lauren is going to apply to you, October. Work with your doctor, tell them what your plan is, let them know how you would like to taper down off of these medications, and find a way to start doing that. You've already had some great success in the group I've seen with these desensitization activities, getting your shoes back on, wearing your brace. Continue with that. And then as things start to improve, you can start to taper down the medication with guidance of your medical provider. Okay? Just want you to know that. Okay, so that's all the questions for this week that were posted in the group. I'm going to also look up a question here that was posted in another group just so I can answer this because I feel like it's helpful. Let's see. Bear with me one second. Gotta find it here. Okay, here it is. So, someone in another group, one of the larger groups, mentioned that they read that a bone scan is most likely to detect CRPS in the first 5 to 6 months after symptoms start. They also read that bone demineralization can happen in stage 3 CRPS. Has anyone ever had a bone scan or other test detecting CRPS or osteoporosis later? If you have already had symptoms for over 1 to 2 years. So they're asking if there's any benefit to bone scans with diagnosing CRPS or detecting it, etc. So I'm going to read kind of my response to that post, so that you guys that haven't seen that can see it. So CRPS is not detectable on scans or imaging. It is only diagnosed using the Budapest criteria, which is something that is determined by observing the affected limb. So the provider will observe the limb. They will look for color changes. They will look for pain that is disproportional to the initial injury. They will look for potential swelling and hair changes. Those are some of the criteria in the Budapest criteria. And you can look it up to see exactly what we're looking at. And it's really just a yes or no thing. Do we see them or not? And if you have most of those things, we might be able to, with that information plus other information you give us, say that, yeah, this is probably CRPS. But CRPS is not detectable on scans or imaging. So a bone scan won't really do much for you, except say that you're having bone demineralization. But that's, as I'm about to go into, that's not caused by CRPS. That's a side effect of not using the painful limb. Um, okay. Same thing with EMGs. When you get like an EMG study, what they're doing is they're just checking to see if the nerves are firing or behaving differently. It's not necessarily caused by CRPS, but it might be a side effect of disuse. So the reason something like bone demineralization happens is because we stop using our foot or our hand, and then our bones stop responding to the use of that limb. So, this is something that will naturally happen if you don't use your foot or your hand or your body, and it's not specific to CRPS. So, what I mean by that is when we walk, run, or exercise, our bones are exposed to forces that make them grow stronger. This is something that is called Wolff's Law. Okay, so force put onto a bone, the bone will respond and grow and adapt in that way. The reverse is also true. If there are forces not put onto a bone, the bone will adapt to not having forces and possibly get weaker or demineralize. The same is true for something like muscle atrophy. If we stop using a limb, whether we have CRPS or not, we will start to have atrophy of muscles. So, an easy way to see this is if I just suddenly tie my arm like this and I never use my arm, or if I tie my leg up behind my my the back of my leg and I never use my leg, eventually on a bone scan, I will have less bone density, less bone uh, mineralization simply from not using it. I will also have less muscle because I'm not using it. Think about it. It's taped here. What purpose do I have with my arm if I'm not using it? Okay. You can see this with someone who is like significantly injured and loses the ability to move that limb, like someone with a major stroke or something like that. Their limb will start to shrink because they're not using it. Not because of the stroke. It's a side effect of the stroke because they're not using it, but it's not like the stroke itself is like causing that type of change. Does that make sense? So CRPS itself is not causing demineralization or muscle atrophy. What's causing it is the fact that we aren't using the limb because we're in too much pain to move it. If we start to move it again, even with some discomfort, we can prevent or even reverse that type of atrophy or bone demineralization. It's a use it or lose it type of thing. Okay. We can kind of see this as we age. If we stop being active, we aren't as boisterous as we were when we were younger and actually like being a little bit more active. So this is someone without CRPS. If they stop moving in around, they lose some of that movement ability. So yeah, I hope that makes sense. I just wanted to make sure I address that because I see that a lot in some of these groups asking about bone scans and imaging. Budapest criteria is the criteria of diagnosis. It is a criteria that is based on observation and subjective reporting by the patient. And that's kind of how we come to the diagnosis in the clinic. Okay, that's a lot, a mouthful. I hope this short Q&A was helpful. I want to do a lot more. If you'd like to be a part of them, please leave comments down below on YouTube with questions that you want answered in the next Q&A, and I'll do my best to answer them for you. Also, if you don't want to comment down below on YouTube, you can join the Window Pane Facebook group, and you'll be able to ask questions there when I do my weekly Q&A post. Anyways, I will see you guys on Saturday the 21st at 2 p.m. US Central Time for our next CRPS Zoom meeting, and I'm excited. It's going to be a big one. Okay, thanks for watching.